For the best medical and paramedical lectures, subscribe to our channel and press the bell icon to stay connected with us. Hello everyone, welcome back to our channel. Today we will learn the degree of burn. So, first of all, we will see what is burn. Burn are the one of the most common household injuries, especially among children and women. The term burn means more than the burning sensation associated with this injury. Burns are characterized by the severe skin damage that causes the affected skin cells to die. So, this was about the burn. It is more than the sensation and it will give the injury to the skin cells. So, most people can recover from the burns without serious health consciousness, depending on the causes and the degree of injury. Most of the people can recover from this. It depends on the degree of burn. More seriousness burns require immediate emergency medical care to prevent the complication and the death. So, if the degree of the burn is higher and the area of burns which affect the body is high, then it will require the immediate emergency medical care to prevent the complication and the death. So, now let's see the degree of burns which are listed here. There are three primary types of burns: first, second, and third degree. Each degree is based on the severity of damage to the skin, with the first degree being the most minor and less complicated, and the third degree being the most severe with have the most severe injuries. The damages including the first degree burns are redness of skin, non-blistered skin. In the second degree burns, we will see the blisters and some thickening of the skin. And in the third degree burn, widespread thickness and a white leathery appearance is seen. These all are the main symptoms appear at the time of burns. There are also fourth degree burns. This type of burn includes all the symptoms of the third degree burns and also extended beyond the skin into the tendons and bones. The fourth degree burns is associated with having all the symptoms of third degree burn and extending the injury to the skin into the tendons and bones. So, first of all, we will see the first degree burn. The first degree burn cause minimal skin damage. They are also called the superficial burn because they affect the outermost layer of the skin. The first degree burn is affected on the only the superficial layer of the skin. The signs of the first degree burns include redness, minor inflammation or swelling, pain, dryness, peeling skin occurs at the burn's heels. Since these burns affect the top layer of the skin, the sign and the symptoms disappear once the skin cells sheds. First degree burns usually heal within 7 to 10 days without scarring. This superficial burn will heal within 7 to 10 days without leaving any scar. So, this is the example of first degree burn. You can see in the image the only the superficial layer of the skin is burned. Redness is skin and blisters are not seen here. So now second degree burn. What is the second degree burn? The second degree burn are most serious because the damage extend beyond the top layer of the skin. This type of burn causes the skin to blister and become extremely red and sore. In the second degree burn, the blisters are seen and the skin will become extremely red and sore. It becomes little hard. Some blisters pop open, giving the burn a wet and weeping appearance. Over time, thick, soft, and squab-like tissue called fibrinous exudate may develop over the wound. If the some blisters pop up and open, and it will wet the injury or the scar, giving the weeping appearance. Over the time, it will become thick and soft squab-like tissue. Fibrinous tissue will develop on the wound. Due to the delicate nature of this wound, keeping the area clean and the bandaging it properly is required to prevent the infection. This also helps the burn to heal quicker As we see the blisters sometimes pop up and keep the injured wound wet, we should keep it clean and do it bandage properly so that we can prevent the infection. Some second degree burns take longer than 3 weeks to heal, but most heal within 2 to 3 weeks without scarring, but often with a pigment change to the skin. The second degree burn also heals without leaving any scar, but after healing, the pigment change of the skin is seen. So here you can see the second example of second degree burn. You can see that it is the injury is deep from the superficial to the middle layer of the skin. Now moving on to the third degree burn. Excluding fourth degree burn, third degree burn are the most severe. They cause the most damage, extending through every layer of the skin. In this third degree burn, every layer of the skin is damaged. There is a misconception that the third degree burn are most painful. However, with this type of burn, the damage is so extensive that there may not be any pain because of the nerve damage. This is a very important thing to learn. There is a misconception that everybody thinks that the third degree burn is very painful, but it's not like that. In the third degree burn, the injury is so severe that it damages the nerve also, so the pain is not seen. Depending on the cause, the symptoms third degree burn can exhibit include waxy and white color scar, dark brown color, raised and leathery textures, blister that do not develop. As this third degree burn exclude the damage in the most of the skin layers, blisters are not seen. So this is the example of third degree burn of the fingertip. You can see every layer of the skin is damaged in this picture. So this was all about the degree of burn. I hope you all have understand it. Do like, leave a comment and share with your friends.